How about the stroke management in Poland?
So actually in Poland we have already reached 7% of all acute ischemic stroke patients being thrombolized, and it is a good result for us. However, we are awaiting to reach more than 10% in the next 2 or 3 years, and this is because the awareness of the society is growing, and also the awareness of physicians is growing. Now we know that time is brain, that every minute counts, every minute is golden, and fortunately we have a very good treatment for patients with acute stroke, thrombolytic therapy, which can be done, but only within 4.5 hours following stroke onset, and we know this.
Is there any stroke campaign in Poland?
We have some local awareness campaigns, however not on national level, but there are many patient organizations who are very active, and they lobby government institutions, and they are very, very powerful, and we really need their help with these actions.
And what does it mean that time is brain?
Yes, we must know that every minute after stroke onset, the brain loses milliards of neurons, and the patient cannot receive the treatment which would overcome this injury. So we must act fast. Every minute is very important. Every minute counts, and the patient must reach to the hospital as quickly as possible to obtain professional help and effective treatment. As soon as the patient comes to the hospital, he will receive effective treatment, but after a few hours we cannot help the patient as much as we could do this if the patient comes early.
And what about the stroke intervention? How does it work in Poland?
We have many stroke units at the moment, more than 170, so we have a good basis to treat patients. We treat them by usage of thrombolytic therapy and also by mechanical thrombectomy for the last 2 years. However, this is the new intervention treatment, and we are still learning how to do this safely and efficiently.
And how many people suffer from stroke in Poland?
Well, we have approximately 120 cases per 100,000 inhabitants, and in my country this incident rate is quite high when we compare with other countries, especially Western countries. Also, the mortality from stroke is higher in Poland than it is in Western countries at the moment, so we must do as much we can to save lives of our patients.
And what is the plan for the future?
Yes, the plan is to raise knowledge of patient awareness of stroke signs. It is very, very important that the patient would recognize stroke symptoms, then to act in a right way. It means to contact the emergency service personnel, not to contact general physician, for example, and to reach hospital as quickly as possible.
Thank you for your answer.
Thank you very much.